and just put in our group. Okay. So you can start from the very beginning. Okay?
Hello.
Yeah.
Good morning.
Good morning.
I'm Dr. Manisha. I'm one of the pediatric registrar doctors here. I presume you're Rahul's mother. Is it okay if I can examine Rahul?
Yes, please.
Well, on general examination, I can see that child appears well. There is no evidence of respiratory distress. The child seems to be having a feeding tube in situ. I cannot see any other catheters on inspection at least. What about the size, the height, weight, and the head circumference and the general nourishment?
Okay, general nourishment is poor, as you can see. Height, weight is not appropriate according to the age. Yes, some of the facial dysmorphism is there.
Okay. So presently the child appears to be comfortable at rest. There is no evidence of any distress at present. I can see that there are some unusual features in the form of hypotelism, low set ears, triangular facies. Any other scars or sinuses which are seen?
Okay, no
on
sinuses,
the face of the neck?
no scars.
Is the child on any other supportive aids in the vicinity?
Okay, no supportive aids.
So I will start with the general examination of the hands. Is there any evidence of clubbing or peripheral cyanosis that I can see?
No peripheral sinuses, no clubbing, but there is a pallor and some of the palmar erythema is there.
Okay, so there is evidence of palmar erythema. So are there any evidence of any any scars or sinuses on the hand? Any congenital
No,
anomaly
nothing.
seen? Okay.
Negative.
Okay, so then I will move on to the face. From what I can see from the picture, I don't see that the child has any evidence of jaundice. Am I correct?
No, there is jaundice.
There is jaundice, and there is evidence of pallor. Is there any evidence of central pallor, central cyanosis?
Okay, there is no central sinuses.
Okay, then I'll proceed with the examination of the mouth. Any evidence of any dental caries or pigmentation of the mouth or the lips?
No such thing is there.
Okay. So any evidence of any lymphadenopathy in the cervical, axillary, or submandibular, any lymph nodes which are present?
Okay, so no lymph node is there.
Then I would like to take the permission and expose the abdominal.
Yes, please.
Abdomen fully. I will start with inspection from the nipple to the knee and then the back. Is there any evidence of any distension of the abdomen?
Okay, the abdominal distension is not there.
Okay, are there any evidence of any scars or sinuses or any peg which is there in situ?
No scars.
Okay. Then I would like to proceed with how is the shape of the umbilicus?
Is normal shape.
Are there any evidence of any dilated or distended veins?
No.
So then I would like to, I would inspect the abdomen from the leg end and the right and the right side as well. I would then start with palpation. And if the child is supine, then I would like to kneel down and ask the child, and if to tell me if there is any associated pain on palpation. So he can tell me if he experiences any pain.
No pain.
Okay. So initially I would start with superficial palpation of all the 4 quadrants. And is there any evidence of pain on superficial palpation?
No pain.
Okay, then I would proceed with deep palpation, starting with hepatomegaly, starting with the right iliac fossa and proceeding upwards. Can I feel the liver? Is there any hepatomegaly?
Yes, is 6 centimeters below the costal margin.
6 centimeters. There is no tenderness or any pain associated with the hepatomegaly.
No tenderness.
Okay. So I would like to then proceed with palpation of the starting from the spleen, starting from the right iliac fossa, proceeding to the left hypochondriac region, asking the child to take a deep breath. Am I able to feel the spleen? Is there any splenomegaly? Hello?
Yes.
Hello.
Yes, the just below the 2 centimeter below the costal margin.
So then I would like to proceed for examination of the kidneys. Is the kidneys palatable?
Okay,
So
is not palpable, not palpable.
is there any evidence of any ascites by shifting, dullness of fluid, any
No, no,
fluid at all?
negative,
Okay.
negative.
Then I would like to go with percussion and take the liver span. I would start with percussing from the right iliac fossa, moving towards the till the
Okay,
resonant
okay,
node. What would be the liver
okay, okay.
span?
It's 14 to 50 centimeter.
40 to 50 centimeter. Okay. Since I cannot feel for there is no fluid, and then I will not proceed with any percussion for fluid. Then I would go with auscultation. Is there any renal bruit, or what about the vowel sounds? Are they heard very well?
Okay, no renal buoy and the bowel sound is normal.
To offer my examination, I would like to examine the hernial orifices and the inguinal region. Are there any scars or
Okay,
any
your time
evidence?
is up. Yeah, negative. All this finding is negative. Your time is up. You can present this.
So today I had the opportunity to examine Rahul, a 10-year-old boy, who to examine his abdominal system. And Rahul seems to be well alert with a feeding tube in situ, with a monitor on the chest. I'm not sure what it is, but there is evidence of unusual features in the form of, as mentioned, in the form of triangular facies, hypertelorism, and low set abdomen. On abdominal examination, he seems to be having jaundice and Palmer erythema.
So what is
And
your most likely diagnosis?
on abdominal system exam. So, sir, I would like to give my first diagnosis as Alagille, taking into consideration his unusual syndromic features and presence of hepatosplenomegaly with hepatosplenomegaly.
Okay. So what are the DDs you are thinking of?
So taking into consideration his a poorly nourished status, I would like to put any chronic liver disease as a differential diagnosis. Along with allergy, any chronic liver disease, it could be any chronic liver disease.
Okay, okay. So how you will investigate this case?
Sir, I would like to start with taking a focused general history from the parent, and I would like to start his centiles uh, um, on a growth chart appropriate for his age. I would like to take his blood pressure and pressure, see for if there is any evidence of edema or any signs of other signs of liver cell failure. And once, if the child has had any previous papers of admission, then I would like to go through those previous papers of admission and get the general information about the previous history of the child. And accordingly, I would like to send the investigation according to the presenting complaint. Since the child has come with hepatomegaly and has got a nasogastric tube in situ, I would like to check for the liver function test. Start with the
What are the expectation of liver function test? What will be the finding?
so since he is presently, since he's got hepatomegaly and erythema, so which could be a sign of liver cell failure. So they could be raised in evidence of in consideration of jaundice. I would think a raised bilirubin with
Okay.
the
What
raised.
kind of bilirubin? Is this conjugated or unconjugated?
It could be allergy. So it is a direct hyperbilirubinemia, the cholestasis.
You mean to say conjugated, right?
Conjugated, sorry. Yeah.
Okay.
Conjugated hyperbilirubinemia. And
And
if the liver enzymes are raised, if the liver enzymes are not raised to the extent of increase in the bilirubin, then it would point to a considerable liver cell failure, but thinking that the child is not in distress with no ascites, so I would expect that there is raised liver enzymes. I would like to check for the clotting factors, especially vitamin K dependent factors and prothrombin time, and the routine full blood count to see if there is any evidence of any infection at present.
Okay, your time is up. Complete the investigation part.
Once I've got the investigations, I would like to inform my consultant, and we would like to take a gastroenterology specialty opinion for the same, and along with the management of his nutritional management, and I would like to always also involve the geneticist
Genetics.
if
Okay.
knowing his genesis, yeah, knowing his syndromic status to know more about it, and yeah.
Okay. Okay. Your time is up. So you presented very well. First thing, and what you missed during your introduction, washing your hand. That part is also important.
Yeah.
Yeah, and I give you the hint of palmaregitema, and after that, you picked up most of the point. But again, during your presentation, you wasted few minutes over the history and the other investigation. You know, like so there will be no so much of time to come to a particular, because examiner will be expecting to discuss up to the management part. So if you just taking the history,
much time on the history
you just wasted a little bit of more time over there.
Okay.
And the rest of the part is, I think, that was good. And I am not sure about. I have taken this picture, but I am not sure about this. Over the chest.
Isn't it a portocat? That's a portocat.
Yeah, most likely portocat, but I have not commented on this one.
It's because you usually see it on the right side.
Yeah, usually this portocat usually have this side is for portocat, but I don't know what is this. Maybe the some of the other anyway, but they have. So jaundice was there, and okay, let's see what are the main management part. So clinical features, yes, cardiac definitely you should mention, okay, because 90% of the patients, more than 90% pulmonary stenosis will be there. So cardiac cardiologist you need to involve. Then hepatic, you mentioned, or the cholestasis mostly due to hyperbilirubinemia, which is conjugated, and that is causing this chronic, like hepatitis like feature. Okay, and renal abnormality need to be involved. Okay, as skeletal, there is hemivertebra or butterfly vertebra maybe. Then that is not clinically that is very difficult, but in the X-ray you can offer an X-ray, and you can, and some of the ophthalmology in like involved, which is for eye manifestation like in posterior mirror also. And this more phases you described, hyperterorism is there, and
so sir, I'll have to mention in the management, I have to talk about all the investigations pertaining to these complications.
Both actually, this will be depending upon the questions what the examiner actually want to know.
Okay.
So these are not in our hand, but we need to be little fast because 3 minutes is very less time.
It should involve a multidisciplinary team that involves like they should go one by one: pediatrician, gastroenterologist, cardiologist, like that. A better way of.
Now, one by one, give your feedback, please.
Well, I have a few things to say. First of all, the establishment of rapport was not adequate. You rushed off very fast, so I think you should spend some time playing with the child we did not take the permission from the mother if present,
Mhm.
then you should be going systematically. Of course, you should look at the general inspection. You should look around the surroundings, then go from the hand upwards. That should be practiced regularly.
Dr. Rajesh.
Yeah.
Hello.
Yeah.
I would like to mention one thing. Previously it was very important to build a rapport very meticulously because they carried 2 marks. That was in the domain. Right now, from this year or last year, the domains has been changed. The clinical, there are 4 domains. One is clinical reasoning. So I will just, sorry, one second. I will tell you. 1 second.
Can
the
you
domains,
please? I can't hear it properly. Can you please? Can't hear it properly. Is it Dr. Kallol?
Yeah.
Kallol call?
Abhishek.
Abhishek. Okay. Please go ahead. Because you need to update. I'm not aware of these things. Hello.
I think he has a little.
Your
poor
microphone is not
yeah.
working properly.
Because,
Dr. Abhishek.
Yeah.
Dr. Abhishek. Yeah. Physical examination. Am I audible?
Yeah.
it's going to be physical, no? It's not
Audible, but there's a lot